And since I have been getting lots and lots of comments, so do please post videos on anti-tubercular drugs, anti-amoebic drugs. So today's topic of my discussion will be mainly focusing upon the anti-amoebic drugs. So students, while looking at the classification of the anti-amoebic drugs, we are going to categorize the classification depending upon the three basic criteria. That is, the drugs which are going to act both on the intestinal and the extra-intestinal sites. Second, that is the drugs which are going to act on the intestinal amoebiasis. And third, the drugs which are effective only in the extra-intestinal amoebiasis. So students, before beginning with the anti-amoebic drugs, let me make this in a short gist. I would like to discuss as to what is actually amoebiasis. So amoebiasis is a disease, it is a condition which is a kind of a bacterial infection, what mostly occurs due to the fecal contamination. It mostly occurs whenever there can occur a fecal contamination of water or food with the organism that is Ent amoeba histolytica. So amoebiasis is basically a condition which is mostly due to infection with an amoeba, that is, the name of that amoeba is Ent amoeba histolytica. So this causative organism is responsible for amoebiasis, and this amoebiasis can affect both. It can occur in the intestinal areas and can lead to watery stools, and that can occur in the extra-intestinal sites also. So while looking at the classification of the drugs what are used in the treatment of amoebic dysentery, the most common condition what is seen due to amoebiasis is amoebic dysentery. So this amoebic dysentery, which is caused by Ent amoeba histolytica in most of the cases, though it is treated by the anti-amoebic drugs. And while looking at the classification, we can broadly divide into three categories. The first class comprises of the drugs which are effective in both intestinal as well as the extra-intestinal amoebiasis. So students, this class of the drugs is basically comprising of the two broad categories. One is the nitroimidazoles, and others, it is the other class of the drugs what are used in the treatment, it is the alkaloids. So students, do remember the drugs what are going effective in both intestinal and extra-intestinal amoebiasis, they can broadly divided into two classes, that is the nitroimidazoles and the others which come under the category of the alkaloids. So students, do remember in this category we are going to have the two drugs known ending with the suffix idazole. So the first drug, it is the metronidazole, the T-nidazole, the ornidazole, the secnidazole, and the cetranidazole. So students, do remember up till here the drugs what are going to end with the suffix nidazoles, they are under the class of the compounds, that is the nitroimidazoles, whereas the emetin and the dihydroemetin, these are the drugs what come under the classes of the alkaloids. So in a broader perspective, in a broader view, these are the drugs which are very good and very effective in the treatment of both intestinal as well as the extra-intestinal amoebiasis. Now moving on to the next class of the drugs, that is the drug of choice, which is mostly used in the treatment only. I would like to emphasize over here, students, that the drugs which are effective only in intestinal amoebiasis, they are also known by the name of the luminal amoebicides. So students, do remember the luminal amoebicides are those drugs which are going to act in the lumen of the intestine. So students, this microorganism, that is Ent amoeba histolytica, when it is going to affect the intestinal mucosa, so it is mostly going to lie in the lumen of the intestine. So the drugs what are used, they are going to have their site of action within the intestine, lumen of the intestine, and hence they have also been called by the name of the luminal amoebicides. So students, under this category we are going to have the drugs what are called as the diloxanide furoate, which is an amide. The next drugs, that is the quinidochlor and the idoquinol, these are the 8-hydroxy 8-hydroxyquinolones. They come under the classes of the 8-hydroxyquinolone class, the quinidochlor and the idoquinol. And there are certain antibiotics which are also helpful in the treatment of this intestinal amoebiasis. It is the tetracyclines. Moving on to the last but not the least, that is the drugs which are effective only in the extra-intestinal amoebiasis. And under this category, we have the very famous drug which is called as the chloroquine. So students, this was a short discussion about the classification of the drugs. Now moving on to the basic mechanism of action of these drugs. So students, do remember, since we are mainly emphasizing upon the anti-amoebic drugs, so here the prototype, the prodrug, what is there, it is the metronidazole. So students, do remember, this metronidazole is going to elicit its mechanism of action by acting on the anaerobic microorganisms. So students, as you might be knowing, it might be very clear to you that within the intestine, the flora of the intestine, it is mostly anaerobic. So students, do remember, this metronidazole, it is a prodrug. Prodrug means that it is an inactive form of the drug which is going to be metabolized into the body, and after metabolism in the body, it is going to get converted into the active pharmacodynamically active form, and after getting converted within the body into the active form, it is utilized to cure or treat the condition. So metronidazole, it is a prodrug that is outside the body, it is inactive, and when ingested into the body, it is metabolized and it gets converted into the active form. So students, do remember the mechanism of action. We are going to summarize by looking at the mechanism of action of the metronidazole. So this metronidazole, it is a prodrug, and when it is going to enter the body, after the anaerobic flora, the anaerobic bacteria, what are there? These are going to reduce the nitro group of the metronidazole by the nitroreductase enzyme. So students, do remember, the nitro group of the metronidazole is being reduced by the nitroreductase enzyme present in the anaerobic bacteria. And after the nitro group is being reduced, the metronidazole is getting converted into the active metabolite form. And this active metabolite form, it is cytotoxic in nature, and this is the cytotoxic, hence it is converted into the cytotoxic forms. And this cytotoxic form of the active metabolite, it is going to bind to the DNA, and finally that will lead to the inhibition of the protein synthesis. So students, ultimately, when protein synthesis is being inhibited, the bacterial cell is unable to further multiply, and hence the ent amoeba histolytica, it slowly the colonies of it won't grow, won't multiply, and whatever the bacteria microorganisms are there, they are ultimately killed. So students, this was a short discussion about the mechanism of action of the anti-amoebic drugs and the classification. So students, if you do like my video, don't forget to subscribe my channel and do press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching. Students, if you do like this videos, you can have a comment section. You can do comment me. It would be very encouraging for me if you do comment in the comment section. Students, thank you for watching.